Hi listeners, Jason here. I'm excited to announce that the Psych Health and Safety Conference, PHSCon, will be returning in 2025. After a tremendous success this year, we're going even bigger and better. Taking place on June 19 and 20 at the ICC Sydney, this will be your chance to join the largest psychosocial safety community gathering. Featuring world-class speakers like Adam Grant, Marianne Baynton and Rob Briner, and practical insights from industry case studies. The conference content is all about leveling up your ability to create work that is better for worker mental health and better for business. Whether you're in people and culture, health and safety, psychology or leadership, this 2-day event and optional pre-conference masterclasses is your opportunity to learn, network and grow. Don't miss out. Super early bird tickets on sale now at phscon.com. Now, on to this episode.
From Flourish DX, this is the Psych Health and Safety Podcast. With workplace mental health becoming a safety prerogative, this is the source of information on psychological injury prevention and health promotion.
Hello and welcome to the UK Psych Health and Safety Podcast. And I'm joined today by my fellow co-host, Kate Field.
Hello.
Have you put the heating on?
Oh yeah, I mean I put the heating on about 3 months ago. It's decidedly chilly. I'm looking out of the window. It looks beautiful because we're getting the final. Was it the blue hour? What's the hour called? Golden hour.
Yes.
But it's still frosty. So yeah, it looks lovely, but I'm glad to be indoors, warm, with a cup of something hot.
Well, I have a cup of tea, but I'm looking out on a loch in Scotland. So
Oh,
I feel like that film where they swap holidays. That's like me. I'm in that sort of that Christmas holiday thing. Where Jack Black and Gwyneth Paltrow swap over. It's called The Holiday, isn't it? Anyway,
it is.
well, let me allow our guests to introduce themselves and to explain who they are, what they do, and how does an American end up in London, particularly from California. What were you thinking?
Oh, hello there. I'm Elizabeth Bachrad. I'm a population health strategist that has somehow decided that the weather in London is a challenge to overcome. So I've come here from California about 6 years ago and largely look at how business has a contribution to improve population health and well-being outcomes. What does that really mean? I look at resource flows, I look at policies and practices, and most importantly about relationships and connections that drive our systems to behave differently. So there's that behavioral science, behavioral economics aspect of it, and largely systems led. So thinking about the interconnections and the interdependencies between what we do, what we enact, how we behave, and ultimately how we work together to achieve shared outcomes.
You see, I told you, Kate,
amazing.
This is going to be an absolute.
My brains were like all the questions I can ask. I was like, oh no, hang on, I need to keep it focused. I'll try.
I know when we met before, Elizabeth. The thing that fascinates me when we were at HSC, we used behavioral economics very much to determine how we put our messaging across, how we change. Now, an interesting thing when we developed the management standards, we used the Jeffrey Rose model of population shift in determining what percentage of the population needed to know to shift the health behavior along. But I'd just be interested because in the context of what we've just gone through, what do you see as the major health, the sort of health elements are that are impacting business?
Well, we see front and center in the UK, the two biggest claims are around mental health and musculoskeletal, right? And they're not disconnected. So we see a large part of the workforce that is working with a work-limiting health condition is largely related to mental health and well-being. So disentangling that involves really getting down to some of those root causes of what that means. And that's the biggest challenge, I think, and also the opportunity that we have is to really ask some different questions to get to the heart of it. And then, of course, what I look at in population health and management of that is looking at the data to understand what we're actually working with. So just to put a spin on that is I think we've masked some of the inequalities in addressing how we look at health and health outcomes. And so to do so and to have better data that unlocks some of the potential, we could actually target our interventions and solutions a little bit more effectively.
So
Yeah.
interesting. So I suppose there's two directions I'd like to go in, and they're quite different. So the first one, a few years ago when we were talking about behavioural health in particular, whether that was in the workplace, and more I would say more generic wellbeing programs, and more yoga and yoga rather than psychological health and safety, but also then looking at public health. Nudge theory was, like the flavor of the month, and it was just like, oh yeah, it's amazing. Now, I'm sure I read something fairly recently that suggested that nudge theory is a bit old hat, and a bit
Yeah.
been and gone.
Well, if we think about the choices that we have to make every day, we're nudged in some direction, right? So whether that's through advertising and promotions, the stimuli that we get from whatever we see on the streets, at the tube stops, at bus stops, what have you. So in theory, we're actually nudged all the time. I mean, my kids do a great job with their nudge theory and getting me to make different decisions. So I think on the surface of it, it has some paternalistic connotations around it, like, oh, we're making people do things, and but at the heart of it is really about the choice architecture. So that meaning, what are we putting in front of people to make decisions? And I honestly think that we have too much. We have too many decisions to make, and that's why nudge theory came into place, is saying, well, if we can make the best decisions, then we have a choice out of good, best, better, instead of all these poor health decisions that people are continually making because it's in front of them. And I'll give you an example from my daughter. I hope she doesn't mind me sharing this, but her school offers food for purchase during snack, lunch, what have you, and the choices that she makes are actually astonishing. And I've asked why she would choose crisp muffins, bakery items, and she said, because they're in front of me. So that's where kind of that nudge theory comes into play. Is, well, if it wasn't in front of her, if it was fruit, if it was vegetables, if it was healthy drinks, not fizzy drinks, something that along those lines, would her decisions be different? And I would say yes, actually they would. So, but that's where the behavioral science comes in, is if we can get those non-conscious processes to be a little bit more quicker in action with better choices, which is also highly political and opinion focused, but still, as a public health perspective, we know what's good for us, and so we can do better at creating those choices for people.
We're a very open podcast, but I know Kate's chomping at the bits here. Keep going.
No, I was just no. I was going to let you ask the next question. I was just going to say I'm all for I go with the not having anything bad in the house, and therefore it's not available to me. So there are no muffins, there are no crisps.
I am the opposite. I have lots of and things that bring me enjoyment, including the curries that the mother of the shop owner that's down the road, a local, makes for me. So, but yeah, it's interesting, isn't it? We've, I mean, psychologically, we've known about different nudges with the synergy between behavioral economics and psychology. And I know at first we were competitive, really. Like, all these sociologists coming in here telling us how to do it differently, but actually it was psychological theory, wasn't it, that we were also applying to behavior, and sort of working our way along. Okay, so we've done the easy one, like nudging on food. How do we nudge people on the mental health crisis that we've got at the moment? Because what we've got, and we keep having this data thrown as numbers are increasing, but how long do we say it's too hard as a behavior to change? Now, I mean, that's a big question, isn't it? But this is what I constantly hear from people. Well, we can't do anything about it. We did it on physical stuff, like we've talked about the other health issues. I'm just interested. I mean, that's a real nightmare of a question to ask you, but it is the question to ask, isn't it? Which is, well, how do we use behavioral sciences to change the direction of mental health in work?
And
You can take
listeners,
as long as you need for
while
input.
Elizabeth thinks for that, I'll just tell you before we started, Peter said, "Oh, I won't ask any difficult questions."
I know, but
Well,
this is
it's
this is like my
this is your chance.
Yeah.
I know, but this is the evidence thing. This is the thing that we both of you have worked in a field of evidence. That's what we look for as inspectors, isn't it? And actually, I mean, yeah, it's frustrating. Yeah, like, no, we can't do anything. Well, if you don't do anything, your employment rules and things happen in work are going to get so bad that people aren't going to be able to stay in work. So.
And it's happening. We see those trends, right? 2.8 million currently out of the workforce due to ill health, and due to rise to over 4 million by the end of this parliamentary um, stance, if you will. So I think there's a lot of ways to look at this, and we have roadmaps. We have ISO 45003. Obviously, that's that you've been very involved in and shaping the framework for understanding how to manage and mitigate risk. Where I think we have an opportunity is connecting that on that system level, right? So if we're looking at behavioral science as a way to improve mental health, we need to look at the conditions where people are making decisions. And if we bring it right down to the workplace, we know that stress is highly impactful on mental health. We know that actually job satisfaction, though, is one of the biggest predictors and promoters of mental health and well-being. So if you want to look at it from a positive aspect, and we also know that we all have mental health, and most of it is subclinical, and so we need to, I don't want to say separate, but we need to acknowledge that the clinical interventions are completely necessary, and we actually do have support mechanisms for that, and government has released more funding for that. But I think what we really want to concentrate in on is the subclinical aspects where people are being affected by their relationships, by their connections, by feeling supported, by belonging. And well, how do we impact that? Well, let's go back to food for a second. What we eat impacts our performance, our mindset, our brain health, our physical health, our ability to focus, our ability to pay attention and engage in our work. And that is a virtuous cycle. If we have those factors in place, then we're connecting to our health and well-being. So if we just put that aside, now looking at relationships in the workplace, do we feel supported by our manager? Do we have a place where we can feel safe to talk about what we think, what we feel, offer opinions, offer feedback without recourse? And so those conditions take a lot of work, and they take leadership, and they take expertise to recognize when something is potentially at risk. But it also requires conditions that foster this ability to be well. So oftentimes I look at things from a health promotion perspective and say, well, we have a lot of frameworks and guidelines around assessing risk, especially from a health and safety executive viewpoint. What can we do to assess opportunities and drive people towards health? And I actually think this is where people have more expertise. They have the ability to share their stories. They have a better opportunity to be peer-to-peer led, and more connection, more support, more opportunities for well-being will foster this better mental health and well-being.
That's the perfect answer, because that is the description of psych health and safety. Create the right environment, create the right consequences and right support mechanisms. You create psychologically health and safety workplaces, which then will lead to people feeling psychologically safe, as we've described, to talk about things when they need to, and where they feel they're okay, they can actually say what's going on. That's a really succinct way of like describing sort of behavioral and a behavioral approach. But it's so interesting because it's very similar to what other people are doing, but they're not putting the maybe the theory around it. Do you think the theory is really important and useful? I mean, we talked a little bit before about Jeffrey Rose and how we use that for population shift when we did the management standards. I'd be interested in that, and then I'm going to let Kate answer the next question because she's got this thing where her lips move from right to left, which is an indication she's going to ask a really awkward question to you.
Let me knock on that first, because I think what we're missing is theory into practice, and actually theory into policies. So we're grounded in theory, right? We have academic research for decades demonstrating the value of investing in health and well-being. We don't necessarily have the actuarial model around what investing in prevention does to improve economic outcomes. So that's a bit of where to start, perhaps. But I think the theory is needed to understand how we think about things. Now, into practice, that's where things get askew, and we run the risk of not having the right implementation structures in place and the accountability mechanisms to bring that theory into light and to test it. Because a behavioral scientist will tell you, Daniel Kahneman will tell you, that your intuition, you still have to test it. Even if you think something is right, you have to test it, and that is part of what we need to embrace. Is that, especially with mental health and well-being, because it's on a continuum, because it's longitudinal, meaning long term, we can't assume that one thing is going to help us today and that thing is going to help us in 3 months from now. And that's the hard part. That's a really, really hard part. And so I think not just conditions, but also measuring those aspects. So I talked about the health promotion. We don't really do a good job of understanding how we measure positive aspects of health and well-being. We know all the risk factors. We know all disease management. We know the cost of ill health, but we have to shift our focus a bit to understand how we measure and monitor the conditions that drive us towards health.
I think like I've met my twin. Like this is the stuff I've been talking about for years, and these are the
I know,
conversations I
Peter.
have with, and these are the conversations I have with Kate when we do these geek out, when it's just me and Kate on the phone. What about this? What about that?
Do you need more psych health and safety in your life? Then head over to the Flourish DX Academy for several free on-demand e-learning courses. If you're an internal professional, follow Flourish DX on Eventbrite to register for any of our free fortnightly interactive webinars. Our flagship professional practice program is also exclusively available for internal professionals. The 12-week course blends theory, applied practice, and interaction with other professionals through live lectures and a monthly community of practice session. Find out more about all these learning opportunities or inquire about a bespoke in-house training at the Flourish DX Academy. www.45003.org. Now back to this episode.
So I think, your last point, that's always been a factor. I think it's always easier to measure the what's gone wrong than the absence of what's gone wrong. And I think, that's been a huge challenge, remains a huge challenge in health and safety, whether that's physical or mental health. We still primarily rely on how many people we've hurt, not how many people that we're creating better well-being or life outcomes for, which I think is one of the really big challenges that we have. But I wanted to come back actually to your comment about peer-to-peer learning and support, because I think that's something that we see a lot of organizations foster, either in an organic way or in quite a structured way. And I think, there is obvious benefits for that. but they're limited. And my concern with a lot of those programs is a lot of organizations go, well, we've created this community, whether it's people who've got mental ill health, or whether it's maybe around diversity and inclusion, so what their particular psychosocial risks that might be associated with that. And the organization goes, job done, rather than stepping up and taking a responsibility for the circumstances or the behaviors or the culture that they're creating. So yeah, I just wonder if you could bring that to life a bit more, and how organizations find that balance between creating that benefit that comes from peer-to-peer, but recognizing that is not an end in itself.
And you were saying I ask hard questions, Kate Field. Good luck with that one, Elizabeth.
Well, listen, I come from a data background, so I would say not to put it up against just looking at numbers, but I think that what happens with data is the monitoring and evaluation, right? So I come from the US. There's a employee resource group for almost anything, you name it. And so there's the opportunity to engage with peers that will understand you, that will hear you, that will listen to you, that actually might advocate for you, that you actually might get paid to host these resource groups. So it's not just a part of your job; it's actually an extended part of your job. So there's all these avenues to foster things that will drive peer-to-peer interaction. In the UK, we have social prescribing, so the non-clinical interventions that are largely responsible for bringing people together to work on their health and well-being together. And we learn from other people. Our trust has broken down in institutions worldwide. So who do we trust? Do we trust our neighbors? Do we trust our friends? We do trust our friends. I mean, generalizing, but more so. And so we're starting, I think, a revolutionary approach. And I know peer-to-peer work is not revolutionary, but I think when we're talking about how we connect trust and build trust and foster those capabilities of what is meaningful and what works, we do look to our peers for that. Now, that's not always evidence-based, so we run the risk of doing something because our friends are doing it. Case in point with all of the GLP-1s and the jabs that will take away some of our lifestyle choices for us. I'll leave that to a side because I know that's another podcast. But like we have to acknowledge that there's a reason why Gallup measures, do you have a best friend at work? There's a reason why loneliness is an epidemic. There's a reason why fostering social connections and understanding that power of what social connectedness does for our health and well-being is part of the movement and part of the revolution. So I think employers especially have a duty of care around this to understand what it is that people need, especially at work.
Yeah, which brings me to my question, which I gave you a bit of insight I might ask, which was well-being has morphed into the best description is it's like an octopus. It has multiple tentacles. I'm not going to ask you to put value on each of the tentacles, but to what degree do all the other tentacles influence the health behavior? So by tentacles, I mean environmental well-being, financial well-being, physical well-being, among and also inclusion and equality and diversity as part of that as well. So it's suddenly become there's lots of things in it, and I'm just wondering what are the important things, or are they all important to improve people's sense of well-being?
They are all important. They all matter. Just like some of us have different values and ways that we want to have goals around certain aspects of those health dimensions. They weigh differently. So and that could change over time with individuals and communities. So I think the best way to approach it is to understand that the wire drivers are connected. indisputably connected. And if we're going to create any measurement or policies or practices, they have to include all of that, and have some form of understanding that is a variable that matters to the overall outcome. So in a data science aspect, you create composite measures. You look at, what is flourishing. What the ONS, Office of National Statistics, has 4 questions they ask about well-being, right? But they're composite measures of happiness over time, of life satisfaction. And so they take different aspects of it and roll it up into one. So we can do that. Um, but if we're going to address holistically what all those factors are, then we have to ask those questions. And so how do we equip people and managers to do that? I mean, that to me is the bigger question, because we have not just a skills gap in that, we have an expertise gap, and that we have a patience gap. I think a patience meaning, the ability to stay with someone for long enough to understand what they're truly going through. And so those are some soft skills that we haven't fostered to understand how every aspect actually impacts the overall outcome.
Yeah, and a patience gap is when you're dealing with like a multiplicity of cases. So if you're a manager and you're managing 25 people, the allocation of time and responsibility of trying to do things for people is there as well, isn't it? In terms of you'll if you've listened to any of my podcasts, you know what I'm going to ask next, which this proliferation of wellbeing apps that has flooded the market during lockdown and since lockdown. Do you have an opinion on it? Because for me, and I've said this before, and I'll continue to say it again, there have been reviews that suggest that the evidence for the usefulness of the apps is low if it doesn't include a system process to it. So you can't simply give someone an app to ask her how they are without doing something with the information that you've got when they're not okay, or perhaps when their well-being isn't good. So you can say they're wonderful. I don't mind, but I wish that there would be more evidence, stronger evidence for well-being apps, because you can buy some well-being apps for £1.99 on anywhere where you want to buy apps. I'm not mentioning anywhere in particular, but you know what I mean. So there is this possibility to take these apps and then transfer them to your workforce without knowing that they're going to be effective.
Yeah, I mean, I started in this space, so I can fully appreciate that technology is a tool, but it needs people and processes behind it. Um, I mean, I'll give you a non-well-being example. I don't drive in the UK. I'm learning to drive, and I say learning because I've downloaded an app to help me with my theory test. I get nudges every day via email of what I'm supposed to do, and yet I have not taken the first step to understand the theory, even just to pass that first test. So there's a block there, and I could do my own analysis and get to the root of it pretty quickly, I think. But it's so liberating not driving. I think that's what it really is. But the thing with apps is, okay, so then what? Like, what is it? Getting someone started, that's a good first step. We know that through fitness apps and trackers, for example, the attrition rate is 4 to 6 weeks at either. So is that long enough to change behavior? Maybe. But well-being is a continuum. It's a process. It's not a try this, see how it goes, put it on the shelf, right? So is there an engagement strategy? Is there gamification? Is there all sorts of things that would keep people on the journey? Well, I mean, yes and no. I mean, it could be the trend, it could be the flashiness, it could be really good gamification that actually matters. But I think at the end of the day, we still need the people around us to give that input into the app and do whatever it does to give us the output. And that requires community, that requires our social connections, and the evidence. Well, I mean, we have to keep accumulating it. There's to me the evidence is very clear around well-being as a lens and a means to a flourishing society. For the app usage, I'm sure there are some that are amazing and some that just fall short of actually creating meaningful change.
I did a post on LinkedIn that I said choosing a wellbeing app is like choosing a dating app. Do you swipe left? Do you swipe right? And it's all on the visuals that are there. So sometimes I think people go for the things that look nice, that looks pretty, and visually they're stunning. But actually, when you get down into the depth of the information, it's stuff that's textbook almost, that's come out of, well, in some cases from textbooks. So I'm gonna let Kate ask the next question, and then we're gonna go for the killer N question. The killer N question.
Don't worry, it's all right. It's not as scary as it sounds. No, I suppose it wasn't. I don't know if I've got a question yet. I wanted a reflection on the apps piece. I think there's a couple of things that, I mean, I think how and why apps are being used. I think I have a big concern when apps are made available to support well-being, but only through a work phone, because what you're doing is encouraging people to stay connected to work. And we know there's a huge issue there. So that's always a worry for me. I think the other thing with apps is that you've got the same challenge that you've got with self-help books, that you have this fooled by winners approach. You hear these great stories of how this book changed my life, or how this app changed my life, and the reality, that's maybe one or two people out of, in app's case, potentially millions and millions and millions. And therefore, we have this false perception about how impactful they are. So I think we do really need to approach with caution. There's a place, I think, again, it's about having a toolkit sometimes, isn't it? Different things, different people. And you made a really important point about, different times in your life. One thing doesn't work all the way through your life. Different things are needed for different reasons. So not a question, just a reflection, to bring us back to Peter for the not the killer question. It's okay.
It's not a
okay.
killer
It's
question.
not.
It's not a killer question. It's a data question, isn't it? If we were to consider where we are now in behavioral economics, and when you started out in this field, when did you start out in this field? 16 years ago?
Oh, no, more than that. Gosh, 2004, 2006. So yeah,
So in
18 years ago.
2004, 18
No,
years ago,
20 years ago.
2004, what were your aspirations for the field, and what would be your aspirations going forward? If you were to ask yourself, where do you want to be in 18 years from now in this field of behavioral economics and in the world of health and well-being? So what was it? What did you want when you started out? And really, what would you like to see? For me, I don't want to keep banging on about prevention, because in 10 years I'll be 67, and if we haven't cracked it, then we've spent 30 years just constantly banging on something which will make a difference, trying to make a change. There you go, Elizabeth. And then after that, we'll finish the podcast and allow you to. I know, because you have to go and pick up your daughter, don't you? So
Yeah, I am. I am, my kids. So I started out in sports psychology. That's where the behavior science came in. So when I started out, I wanted to work with athletes and improve their performance, their mental performance, right? So even at the end of the day, I was still looking at how to enhance performance, and for whom? Because with athletes, especially professional athletes, they're making money, and for their fans, for themselves, what have you. And I think very quickly I did an internship at a community-based organization called the YMCA in San Francisco, and I saw the disparities with how people engage with their health and well-being, and why some can access it and some can't. So 20 years later, I'm with you, Peter. I'm advancing health equity through preventative health measures, and that is, and my key role there is to have employers and businesses understand their responsibility in making this happen. And so that's where I am. That's where I hope to see it. Sir Michael Marmot of the UK will always tell you that he's been doing this for decades and inequalities are getting worse. So why does he keep going? Because there's pockets of hope, and there are people doing amazing things in this space. And it's always going to be a movement, and that requires us to bring people along with us.
Yeah, Michael Marmot and Rob Brainer and others, and it's people that are there who are deeply passionate about the area, like yourself. That that's how we bring about change, and that's the reason why we do this podcast to inform people of good practice, and that. So, without any more time, I'm going to thank you for coming on to the podcast. It's been brilliant.
My
I
pleasure.
could honestly have spent another hour, an hour and a half, and because I love data.
Let's do another one. Let's do another one on data.
We'll do another one on data. Yes, let's do a round table on data. That'd be great fun, wouldn't it, Kate?
That would be very geeky, but a
Love it.
really important one.
Yeah, brilliant. That's it. Okay, so all it leaves me to do is to thank the listeners. You can download and listen to on your various podcast platforms, and if you want to see us on the live screen, you can go on YouTube, and hopefully that won't scare you too much. So thank you very much, and that's us finished. Bye for now.
Bye.
You've been listening to the Psych Health and Safety Podcast. To stay up to date with the latest on psychological injury prevention, follow Flourish DX on LinkedIn and subscribe to the Psych Health and Safety Podcast at www.psychealthandsafety.com.